Everyone, thank you for joining for today's webinar. Myself, Malarvizhi Joshi, Associate Professor, Department of Psychiatric Nursing, Sarvodaya College of Nursing, Bangalore, and also moderator for today's webinar. Today, we are conducting a webinar on account of World Cancer Awareness Day. Topic of the webinar is Nurses at Forefront in Cancer Care Delivery. Resource person for the day is Professor Dr. Malarvizhi K. Natarajan, Principal, Hosmat College of Nursing, Bangalore. Now, I would like to welcome our Chairman Sri V. Narayanaswamy and our Managing Directors, Mr. George Thomas and Mr. Sunoj Matthew, our Principal, Dr. Dinesh Selvam S., and all the HODs, faculty members, and participants of today's webinar. I welcome you all. As there is a limited capacity on Zoom, I request the participants who are unable to join on Zoom to join using the YouTube link, which is shared in chat box, and I also request participants to keep your audio on mute. If you have any questions during the presentation, please type them into the chat box. I will bring them up at the end of the presentation. And we will also have time for questions at the end. Also remember that e-certificates will be emailed to the participants who submit the feedback form. And the feedback form link will be shared in chat box during the webinar. Now, our Principal Sir, Dr. Dinesh Selvam, is going to address the gathering. I heartily welcome you, sir.
Thank you, Joshi. A warm welcome to all the participants. This is another webinar series from Sarvodaya College of Nursing. And Sarvodaya College of Nursing conducting a lot of webinar series, which is very educative and creating awareness for the nursing students and also the other faculty. And this webinar on awareness of World Cancer Day, where I had a good conversation with Professor Malarvizhi ma'am. She's very kind enough to accept to be a resource person and to give her valuable experience by being a speaker for this webinar. Because I don't know whether I will get any other apt person to be a resource person for creating World Cancer Day awareness, because ma'am's experience and Dr. Malarvizhi's work with the cancer patients was really very much interesting, and I felt so happy that we have a very good resource person for today's webinar, and it's going to be very informative. The nurses who are participating here should get into the details of madam's presentation and which you have to take in, and it's going to be really helpful to know more about cancer and the role of nurse in preventing and treatment of cancer in all the aspects. We have greetings from our respected chairman, Sri Narayanaswamy, and also our managing directors, Mr. Sunoj and Mr. George, who are very supportive and kind enough to organize this kind of educational series and webinars for all the viewers. And I think the participants, around 322 people have already registered. And as already our moderator told, we can accommodate only 100 people, and the YouTube link is generated and it is being circulated. You all can watch in YouTube live also. I'm not going to take much more time, as we all are very much interested to listen from our resource person, Dr. Malarvizhi K. Natarajan. Thank you, Joshi. Over to you.
Thank you, sir. Now I call upon Professor Jolly Joseph, Vice Principal, Sarvodaya College of Nursing, to introduce today's resource person.
Thank you, Joshi. I'm very happy to introduce our resource person for the day, Professor Dr. Malarvizhi K. Natarajan. Ma'am is about to complete her Ph.D. in nursing in breast cancer-related lymphoma. Ma'am has completed her MSc in medical surgical nursing in cardiothoracic specialty and a certified lymphedema therapist from USA, MD in alternative medicine, MS psychotherapy and counseling, MA in childcare and education, and ma'am is also a lead auditor under ISO. Ma'am has completed her graduation from College of Nursing, Madras Medical College, and did her post-graduation in Sri Ramachandra Institute of Higher Education and Research Studies, wherein she has passed with distinction and was the first gold medalist of the institution. and also had achieved Best Teacher Award twice. Ma'am has also worked as a senior clinical nurse advisor in corporate sector and has started her counseling and treating patients with lymphedema since 2006, and also had worked as principal in Garden City College of Nursing and also currently working as principal at Hosmat College of Nursing, Bangalore. As I have mentioned, ma'am is the first nurse lymphedema therapist. She is the first nurse lymphedema therapist in India and the only therapist for the whole of Karnataka. And as a certified lymphedema therapist, ma'am is practicing independently, and she is the entrepreneur for the various lymphedema patients, being an expert in this field and treating the patients with great success. I think we are lucky enough to get you, ma'am, as the resource person for the day, as you are the apt person to talk on this World Cancer Day celebration. We heartily welcome you, ma'am, and I can request you to kindly take over the session, ma'am.
Good afternoon to one and all here. I take this opportunity to thank Dr. Dinesh Selvam sir for having me as the resource person today. And Jolly ma'am, you have given a brief introduction about me. Thank you so much for that. I thank the organizing committee and the chairman of Sarvodaya College of Nursing for accepting me as a resource person. I will directly just go to the topic. So good afternoon all gathered here. I'm going to just start with my session. Yes. So the topic today we have been asked to discuss is nurses at forefront in cancer care delivery. Yes, I had been in this profession in nursing for at least for 20 to 25 years. And very recently, I am just having this contact with cancer patients, and I'm really enjoying as a nurse. Now, how today's webinar is going to help each and everyone. Only by talking and only by seeing is not going to help us. We have to put it into practice. And I also tried many times, only by just teaching, it doesn't work. We have to enter into the field. Then it really makes a big difference. So here I'm not presenting as K and Malarvizhi, but as a nurse, I'm going to present that we all can do if we have a will. So that's what I'm going to share with you, even though certain things are going to be from the internet, because we want to know what is happening around us, what others are talking. That I'm going to just give a short glimpse, and then I'm going to just share what my experience also, where it will really motivate each and everyone to join each other in helping our society. And we should see that the cancer should be handled very nicely. I'm not going to tell that we are going to eradicate it. It is not possible, but we have to handle in a better way. That's why we are gathered here. So let us see what is that we have from the world around, and then we go into what we are doing and how can we join together and take over these patients in a better way. So why Cancer Day is celebrated? Because cancer is one of the leading killer diseases, costing the lives of 9.6 million people annually. Now, the World Cancer Day is observed on February 4th to promote awareness of cancer. Now, the 2022 to 2024 theme for this World Cancer Day is Close the Care Gap. This is the 3 years campaign where we are just telling in a common theme called as Close the Care Gap. Now we are going to see what are all the aspects we are going to cover in 3 years. So why this has been? Here, the main theme, Close the Care Gap, what does it say finally is everyone deserves access to cancer care. I know we are all in the midst of the pandemic, that is the COVID-19. I know each and every individual as a healthy person also how much everyone has been affected throughout the world. So now, how many people have just not able to reach the facilities, the service centers, even though we were having the attitude also. So these has kept us away, and we have seen patients not able to reach, and the initial stage cancer has just prolonged to or just taken to the advanced stages. That is the pathetic condition what we are seeing in this oncology department. So why we are talking about this theme? Because we have many population where the equality is not being considered. Let it be by race, let it be by region, let it be by gender, whatever it may be, we are facing a discrimination. That's what we are going to talk about. And we wanted everyone has the right to have their health status in a better way by just promoting equality. Now, if you see, we may talk about male and female. Now, transgender is really coming up. They are also asking for rights. Now, that population is really neglected. So the transgender populations and refugees are some groups that are often unable to get the proper treatment until their cancer has progressed to an advanced stage. Now, coming on to race, if you see in the research studies, you can see that the black women are more affected. And if you see certain times, the white women are affected in certain types of cancer. Now, more than 90% of cervical cancer mortality occurs in middle and low income countries. Even though the whole world is affected by COVID-19, but we have still badly affected the countries which are in the middle and low income status. Now, what is the purpose of celebrating this World Cancer Day? You have the Union for International Cancer Control, which decides the theme for this by analyzing, by just doing a survey of where we are lacking, what we are deficit with, how we can manage by inviting people and promoting this education. This is the function of this UICC. In that case, what does it do? It make people aware of how to identify the symptoms of cancer, educate people, as well as to prepare government and non-governmental organizations to help in fighting this deadly disease all over the world. Also, not only giving this awareness, but it is also helping to reduce the misconceptions about cancer and to help people in getting the right information about it, so that we see that this day is celebrated to remove these kinds of social myths. Because the cancer, when you just see, I have seen the stigma. Leave about when my students are going, my institution students are going to community, I tell, please do a survey where all the diabetic patients are there, where all the cancer patients are there, because we can extend our care to them. Okay. The moment we go and ask, they hide. We don't have cancer. If we come to know that they have cancer, they avoid our students itself entering there, thinking that because we have a problem, especially cancer, people will get to know, and there is still a stigma. Even our students, our faculties are ready to go and help them. They clearly say that please don't enter into our house. We are having a bad opinion from the neighbors. Please avoid coming to us. I have a co-ed college. When I tell my male patients, breast cancer, please don't neglect. You have to go and see the patient. What is it? See and come along with your teachers, I tell. But what is happening here is they have the shyness. They don't want the male. Leave about male, female nurses also, they don't entertain. So these are all some of the stigmas we have. And there are so many myths. When we get cancer, we may not survive at all. This is what is the common problem that is creating stigma among our society. Now, this World Cancer Day 2022 to 2024 theme we have, as I said, it has 3-year campaign for impact. So 2022 year is mainly to realize the problem. What is the problem? Now, 2023, uniting our voices and taking action. 2024, together we challenge those in power. So Each year there is some goal being given, but it doesn't mean that we have to realize the problem and keep quiet and just wait for 2024 to act. No, we can just do simultaneously whenever possible, whatever situation is, and we can just promote ourselves, join together by doing it and bringing the outcomes, sharing or disseminating among our profession so that it helps each other in helping this type of patients. So the World Cancer Day is more than a day on the calendar. It doesn't mean that on 4th only we are going to talk about this, February 4th. We are going to continue, build to inspire change and mobilize action long after the day itself. A multi-layer campaign means more exposure and engagement, more opportunities to build global awareness, and ultimately more impact. Now, this 2022 realizing the problem, what we are going to do is, it is that we are going to just understand and recognize the inequalities in the cancer care around the globe, and also have an open mind, challenging assumptions and looking at the hard facts. What are those? Inequity in cancer care costs lives. People who seek cancer care hit barriers at every turn. The income, education, location, and discrimination based on ethnicity, gender, sexual orientation, age, disability, and lifestyle are just a few of the factors that can negatively affect the care. The gap affects everyone, including you and your loved ones. These barriers are not set in stone, they can be changed, and it is in our hand. Now, in 2022, what we can do? This is a year to question the status quo and help reduce stigma, to listen to the perspectives of the people living with cancer and their communities, and let those lived experiences guide our thoughts and actions. Now, how can I identify this? By conducting research, by going and surveying, by just sharing with like these platforms. You can just come across and tell, these are all the things we have done, these are all the outcomes we have faced, so it will all help. So that's how we can begin to imagine a better way of doing things and to build a fairer vision of the future, a future where people live healthier lives and have better access to health and cancer services, no matter where they are born, grow, age, work, or live. I'm not going to talk about 2023 and 2024. We can leave it for those years. So we will go directly to what we are going to do in 2022. So to close the care gap, what we have to do? Pledge yourself to spread awareness and end the inequity towards killer disease. That is what the Cancer on this World Cancer Day 2022, we all can take an oath. So amidst the height of this pandemic, we found that 840 successful activities in 116 countries were organized, which included orange color light up in 152 iconic monuments in 91 cities. That means already it has started. And this year, 37 cities globally are planned to be lightened up with the orange and blue lighting to support the noble cause. Apart from this, involvement of medical centers and international organizations, setups like corporations, local businessmen, or the businesses and governments join to guide the public on types of cancer and its potential management strategies. Now, by 2030, it is estimated that 75% of all premature deaths are going to be due to cancer, and it is going to occur in low and middle income countries. Now, this care gap is not only between high and low resource setting, it is disparities which exist within most countries among different populations due to discrimination or assumptions that encompass age, cultural context, gender norms, sexual orientation, ethnicity, income, education levels, and the main thing is the lifestyle issues. Because of this COVID, we are working from home most of the time, most of the population. So there is a great risk for this cancer because of the lifestyle changes. These factors potentially reduce a person's chance of surviving cancer, and they can and must be addressed. Now, Today, I have taken breast cancer awareness. Why? When you have seen in the introduction, cervical cancer is the leading cancer, but why we are going to talk about breast cancer? Not because I have taken this topic. It is the common thing where we have surpassed cervical cancer and now breast cancer is the leading one with the recent reports. So what are the facts and figures in India? It is the leading cause of cancer deaths with over 2 million cases worldwide. And the alarming facts are in India, it has surpassed cervical cancer and is the most common cancer in women. And you can see that 1 in 22 women are affected by breast cancer in India. There are 1,62,468 new registered cases and 87,090 reported deaths in India when it was being surveyed in 2018. Breast cancer is more common in urban areas and cities as compared to the rural parts of India. Now, if you see many studies, we are just seeing that Mumbai, Delhi, Bangalore, Kolkata, Chennai, and Ahmedabad form the 1/3 of all female cancers here. More than 50% of the diagnosed cases have been detected at relatively advanced stages, which reduces the survival rate of the patients. A high mortality in breast cancer has been found profoundly due to delayed diagnosis and lack of awareness. Now we can understand why this awareness is getting created. Apart from this, 63% of female breast cancers are found at the local stage. The cancer is in the primary site and has not spread or metastasized. The 5-year survival rate for local breast cancer is 98.9%. This is the number of people in a treatment group who are alive 5 years after they were diagnosed. About 5 to 6% of women with breast cancer first find it after it has been spread. Here are the 5-year survival rates by stage. If it is localized, as we said, it is 99%. If it is regional, it is 86%. And if it is distant, it is 29%. So most of them in India are with advanced stages. That is the challenge we are facing. Now, there are other things also, which the recent studies I said, where it has brought the breast cancer into the leading cancer among females, because they saw in 2020, 12% of all new cases annually across the worldwide was breast cancer, according to the WHO. In 2022, it is estimated that about 30% of newly diagnosed cancers in women will be breast cancers. And usually we think that breast cancer occurs in patients who are above 55 years. No, the scenario has changed. Now we can see women under 45 being diagnosed with breast cancer. And the blacks are more affected than the white women. 85% of breast cancers occur in women who have no family history of breast cancer. So usually what we say, your mother or your sister or someone in the family has, means then you go for test, we say. But now you can see the number, 85% of the breast cancers occur in women where there is no family history at all. So the most significant risk factor for breast cancer seems to be the sex, being a woman, and the age growing older. But here that also has been overbeaten, because under 45 also we can see patients with breast cancer. 5 to 10% of breast cancers can be linked to known gene mutations. You must have heard about BRCA1 and BRCA2. So those are all mutations or the genes where it is inherited from one of the parent, either mother or father, which is common. Women's risk of breast cancer nearly doubles if she has a first-degree relative, that is the mother, sister, or daughter who has been diagnosed with breast cancer. Now, what are the other reasons why the breast cancer is neglected? 50% of the women avoid breast health due to busy lifestyle. How many of us we are doing self-breast examination? We know that is the easiest way in our hand, but we know we don't have time to do that because we don't want to do that. We are having a threat, the stigma, the fear. If I do that, will I have any differentiation? Will I be diagnosed as breast cancer? This psychological trauma we have and we neglect that. That is what the 50% we are talking about. Okay. And because of the busy schedule, we get up in the morning, we are busy with our work, and we just retire for the day, not taking care of ourselves. These are all the people who are falling in this 50% group. 18% of women didn't feel the necessity for routine examination. Whatever you say, annual examination is required, but we don't follow that, especially in India. And 2%, as I said already, of 2% of women felt shy or were not comfortable to do self-examination. They don't want to see what is there in their own breast itself. That is what is the pathetic condition we are facing here. Now, what are all the unmodifiable breast cancer risk factors, which we can't do anything, but we can alert them by informing in this awareness programs? The female gender, of course, you can't change. So it is the primary risk factor, being a woman. Increasing age, again, even though it is seen more in above 55 years, but other women also should be considered. Gene mutations, as I said, BRCA1 and 2, reproductive history. If you come across women with early menstruation or late onset of menopause, then please alert them. If the dense breasts make recognizing tumors on a mammogram difficult, then they are at high risk. The personal history, the history of breast cancer or non-cancerous breast diseases, these are all at risk. Family history, first degree relative with history of breast cancer or ovarian cancer to be considered. Radiation history, previous radiation therapy to chest or breast before age 30. Of course, in this category, you can think about occupational hazards because of radiation, because most of us now we are coming across with usage. Leave about occupational, the lifestyle. We are handling our laptop and our mobile phones, which are all the basics of radiation spread. So we have to think all this, keep in mind. And what are all the other problems we are facing in this cancer world? Unavailability of healthcare workers and services. Leave apart the risk factors. Now we have other problems. What is that? Unavailability, healthcare workers. Now you can see that there are so many openings abroad. The reason is they all wanted to take care of their population with good health condition. So they wanted the healthcare workers. But in India, we are already having a shortage. So these are all problems we are going to face. And because of that reason, we are not able to achieve what we wanted to do in prevention of cancer and in treatment of cancer. So let us see what are they. Lack of access to healthcare workers and services continues to be one of the biggest hindrances affecting cancer in the country. One of the doctor was telling that in India, the number of healthcare providers available to treat cancer is inadequate considering the large number of cancer patients. We have only around 4,000 oncologists for our entire 1.3 billion population. Most of the cancer care centers are overcrowded and patients wait for a long period to get their treatment. Now coming on to nursing. Do you all know that International Council of Nurses estimated that the world could be short of 13 million nurses by 2030 if no action is taken to bring new recruits into the healthcare workforce? And in 2014, the World Health Organization estimated a need for more than 9 million nurses by 2030, according to a study from 2019. That shortfall is only projected to decrease by 2 million. Again, this disproportionately affects low-income countries as well as the rural and remote areas. So this is what is the scenario we have in our country. Now, what is the other thing? The rural areas. Around 70% of the cancer patients live in rural areas with no or minimal cancer care facilities. Approximately 95% of cancer care centers are located in urban areas. Commuting to the urban area, accommodation and financial difficulties are the main logistic challenges faced by the rural people. Additionally, cancer treatments require multiple visits for weeks together, making travel more challenging, especially in this pandemic period. The dearth of latest diagnostic techniques and treatments in India, that is again the next problem. There is a notable limitation as compared to the developed countries. Sophisticated treatments like radiation therapy, usage of monoclonal antibodies, and immunotherapies are not affordable by many patients because of their socioeconomic status. Now, what is the socioeconomic factors which is affecting the cancer care? India spends less than 2% of the GDP on its health care. Out-of-pocket expenditure remains the main mode of payment for more than 3/4 of cancer expenditure in our country. Even though there are government centers, they are overburdened and patients have to wait for days to months before starting treatment, leading to a significant delay in the treatment. Even though a fair number of private hospitals are providing excellent quality cancer care, these centers are beyond the reach for many because of financial reasons. People who live in rural areas or small cities have to travel for long distance to get the access to basic cancer care, which subsequently delays their timely treatment, making the situation even worse. Similarly, lack of education results in lack of awareness, leading to delay in detection of cancer itself. Now, COVID-19 and cancer care. According to a study by Institute for Health Metrics and Evaluation, the ongoing COVID disease pandemic has certainly slowed down cancer care progress. These delays and decreases in cancer diagnosis and treatment protocols have major impacts on the lives of cancer patients. A Lancet study stated that all cancer services dropped significantly between 2020 to 2021 in India. One of the leading radiation oncologists said on this World Cancer Day, during these 2 years of the pandemic, what we have observed is that many newly diagnosed cancer patients in 2020 avoided hospital visits and thence the treatment or shifted to alternative treatment modalities due to the delay in the treatment. They become an advanced stage and lost the opportunity of cure. Cancer patients not to abandon the treatment at any cost and get vaccinated on a priority basis unless stated otherwise. So we insist on vaccination, and government also has accepted to give priority for comorbidities, especially cancer patients, so that they come across, they can just travel and they can avail the treatment protocols. Quoting research by American Journal on Epidemiology, she said more people will die due to cancer than COVID in these coming years. So the crystal clear indication are to get timely treatment with adequate safety measures for all cancer patients. So now you can understand why I'm clubbing this COVID-19 pandemic and cancer. Does it have an impact? Yes, it has an impact for the delay in approaching the centers, even though we stay in a highly metro cities also, many of them didn't reach. This is in reality, we have come across with the patients. Now, the other one area where we miss out is the palliative care, importance of palliative care. Experts note that palliative care, a special approach to caring for anyone with a serious illness such as cancer, can go a long way in helping cancer patients. There, however, is a lack of palliative care facilities in the country, making it another factor affecting cancer care. When cancer care patients cannot be cured of cancer, we try to control their symptoms to improve their quality of life. This is called palliative care, and it is aimed at reducing the suffering by achieving pain and other symptoms control. It is an important aspect in cancer management, which is not often talked about. So today I visited a rehabilitation center where I want to see what is the facility so that whoever the cancer patient comes, I can be able to reach them. It is a newly founded palliative care or a rehabilitation center. Not only cancer patients, any patients who require rehabilitation, including cardiac, including neuro or ortho, they are taking care, but they have given more importance to cancer patients. So they have started very recently, but they have 4 branches in Bangalore itself, and they have extended the branches to other states also. That was really good thing I was hearing when I wanted to address this topic. I was very happy. Today I visited that, and I'm happy people are analyzing and bringing it. This is what we have to share by seeing, analyzing, and sharing among ourselves to disseminate the information so that everyone join together to help the needy at the right time. One of the senior consultant also said that This does not necessarily mean the last stage of disease. That means once we get to know that a patient is having cancer, we think that that is the end for the patient. Leave about the family members. We professions itself, we will not be taking much care if you just compared with any other comorbidity. So that idea should be removed. The survivors in any stage of the disease must be supported enough to lead a quality life with minimal suffering. Let them be in an end stage, but still we have to provide the best care, the comfort, the reduction in the symptoms so that they have a very peaceful death. If we just recollect what is the definition for nursing, we will be really thinking it's rightly said that it's not only merely treating the patient, it is helping them to have a peaceful death also. Even mere talking about diagnosis, treatment, prognosis, and expenses can be a part of palliative treatment. Despite its importance in cancer care, India is still far behind in providing palliative care to the patients. Many more professionals need to be trained in this aspect. With the increasing aging population and increasing cancer cases, a greater number of palliative care centers need to be established. Now you can understand why did I tell that today I visited that center, because I want to know what they are doing, and I'm very happy that there are openings where the people can think forward and take the help from them. Again, the same oncologist said that everyone should get a fair chance to live a healthy life, have better access to healthcare, especially the cancer services, no matter what their education status, financial status, where they were born, where they live, or where they work. What is the goal? It's very simple. Health equity now. So how can we do this? Educating the public about the cancer prevention, equipping healthcare professionals with skills and knowledge, including about how inequity influences cancer care, strengthening primary healthcare delivered in communities, addressing through policy and programs some of the social and economic factors that can negatively affect people's health, increasing the resources, meaning both money and people, dedicated to cancer research and tracking the burden of cancer nationally to more effectively shape our investments, implementing country-specific cancer prevention and control plans that address each country's unique needs and resources. So as individuals, we have an important role to play for this. How? By raising our voices and pressure governments to address the root causes of these inequities and to treat cancer as an important health issue, and by challenging, especially directly, vocally, and unwaveringly, the stigma and discrimination in all its forms to be eradicated. How can the cancer care gap be bridged? We have to stress the importance of increased investment and strengthened healthcare system by the government and policymakers. Efforts should be made to improve cancer care access to the whole population in a uniform manner, irrespective of geographical and socioeconomic barriers. Simultaneously, we should work towards increasing awareness in the general public to improve the understanding of cancer so that myths, misconceptions, and stigma are minimized. This eventually will percolate into prevention, early detection, and timely treatment of cancer. Now, one of the oncologists said that what can we do to prevent? Screening for cancer is advocated for early diagnosis and reducing the deaths from cancer in following circumstances. The breast cancer screening with breast self-examination, annual physical examination by a nurse or a physician, and a sonomammogram after age of 45 years will be helpful to diagnose or screen the breast cancer. Colonoscopy in people who are at high risk of cancer of large intestine can help. Low dose of CT scan for smokers. Serum PSA, even for prostate self-examination, also can be recommended for men who are at the age of 50 plus after discussing with the urologist. Most cancer patients are not covered by insurance. This is the leading challenge. They have to just pay from their pocket. Even though insurance for other diseases are being entertained, but for cancer, the moment they get to know cancer, the insurance people are also not very cooperative. So it just puts them or make them to pay from their own savings. Schemes such as the Ayushman Bharat scheme and the Universal Healthcare Insurance Program are made available by the government to help people with poor economic backgrounds who require cancer care. So we should appreciate that India has taken initiative in just having these schemes, which at least is taking care to certain extent of this people who are at a low socioeconomic status. More such schemes should be encouraged even in the public sector. It is quite important to spread awareness among people regarding these schemes so that they can get enough support and coverage for the cancer care. Again, not only giving awareness about cancer disease as such, what are all the facilities available also, that awareness to be created so that people will be able to access that and able to use it for their status. That will really help them. Now, unity is the key in bridging this ever-widening cancer care gap in the country, as combined efforts can play a major difference. Now, unity here, what I tell, it is not, you're talking about at the India level, at our small, one city, one rural area, one particular community, anywhere the unity is the key, because we should be united to take that cause and find the problem, identify the problem and find a solution for that. There is a need to aim for preventive and early detection services. A less costly and more effective health network is the key. Advanced equipment for treatment and necessary drugs should be made available to all at fair cost all across the country. Now you can see an example of this simple COVID vaccination. The government is doing good help to give for everyone free of cost, but we are sometimes more eager, we go and do by paying in a private organization. It's okay, because there are certain attitude in people. They say that I can afford, I can go and take it. Let the people who can't afford take the government facility. That is a good attitude, but not rushing and going and taking the free things, because we can avail, but we can help others in this way also. Now, recently I got an information when I was discussing about this World Cancer Care Day. I was in touch with the ADG Nursing. She is representing the Ministry of Health and Family Welfare, Government of India. She was just telling that the government has appointed community health officer in health and wellness center for every 5,000 population. That means they have just worked out to overcome or find a solution for this problem. One element of this service here is population-based screening. So that particular nurses who are being appointed as community health officers will be covering the 5,000 population in providing screening activities. That is a good news. Now, what as a cancer oncology nurses, how you can raise this awareness and save the lives? First is prevention. Despite we know what are all going on TV or in other medias, what we are supposed to do, where we have to put this alerting, it is in the community. So we have to get involved in community cancer prevention. So as a nurse, what we can do, have a tremendous role in cancer prevention by not only to follow cancer prevention primary and secondary screening recommendations, but to also help educate others about the importance of prevention. The term others can be a broad category, but it includes everyone from patients and family members to other nurses in all fields of practice to providers to community organizations. One of the most valuable tools oncology nurses have in their arsenal is the ability to build deep professional relationships with their patients and family members, along with other caregivers. Using our cancer-specific expertise and experience, along with the ability to build those trusting relationships, oncology nurses can convey the importance of cancer prevention across countless different settings. So, how can we do? We have to conduct community programs, share the prevention information, then you have to just come together in screening aspects. We have to just alert the social media channels, bring them into social networks, and of course, utilize the traditional media outlets like newspapers, television, radio, etc. Now we have the very good media, that is our mobile phones. We just simply forward the informations. Let it be, instead of talking, gossiping about unnecessary things, utilize that as a good way by just sharing the information so that people are getting into what is happening around them. Overcoming the cancer prevention pitfalls. How? By interprofessional teams for collaboration. One way nurses can ensure that the prevention message stays alive, both in and out of oncology setting, creating partnerships with others on the healthcare team, making sure that people are hearing about prevention and early detection at different touch points, and a team of people with varying areas of expertise can come together, complement each other, and provide different perspectives. Now, I'm going to show you an example. I just came across one of the Facebook message. Here, a doctor has written, just for your information, how nice to read. We think that we are nurses, we are not being identified. We are health technicians, we are not being identified. Just go through this one slide. I was so impressed. So that's why I'm sharing in front of you all. This particular doctor, who is working in one of the leading hospitals in Bangalore, she wrote, "Today my day started with a great note when I saw this review on Google. This family came down to see me at so-and-so hospital, Bangalore, all the way from Assam. She had a complex ovarian mass, and after our initial assessment, we knew it would be a non-cancerous tumor. She underwent robotic surgery, and as expected, our expert pathologist and team informed us that the frozen section test showed no signs of malignancy. That is, it came to be benign." Think about how much tension they would have had, that family members, including the patient, when that thought has been nullified by telling that it is benign. How happy everyone would have been. 36 hours later, she was out of the hospital. My assistant doctor made them feel at home by talking to them in their local language. My OPD nurse assistant helped them to get their pre-operative evaluation and admission, since they had language barrier. My anesthetist ensured that she had a smooth anesthesia. My scrub nurse, who has become an expert in assisting me in robotic surgery, and our technician ensured smooth docking and undocking of the robotics. With this kind of support, we finished the surgery skin to skin in 90 minutes. Post-operative recovery credit goes to my nursing staff in that particular ward. So next time when you read a review about me, please remember it's a teamwork that helps our patients to heal and recover. I hope you all will appreciate this. This is one oncologist, a surgeon, oncosurgeon. She has written, and I am in touch with her, not because I am in touch with her. I just went through this particular message in the Facebook. I was so much impressed that she has not left anyone in the team. She has just identified, appreciated, acknowledged. This is how we have to be. No one is priority, no one is less. Everyone are going to work together for our patients. If patients are not there, we are not there, whatever our education may be. So in our nursing profession, we need to just mingle with our health team members to provide the best care for our patients. Now, what is as a nurse we have to do? Coming on to our area. Nurses are central to healthcare delivery in all disciplines, and oncology is no exemption. Nurses are crucial members of the healthcare team. We all know that, especially in cancer prevention and control through lifespan. To prepare nurses for this major role, educational programs in cancer prevention and detection must be introduced for all nurses, because we are talking about awareness lacking in public. No, our nurses, any profession for that matter, we ourselves are not aware about many things. So we have to get educated, then we can make our patients be aware of this. Now, what is the role of the nurse? More emphasis about risk factors, history and screening, simple set of questions, more focus on client education through lectures, leaflets, posters, etc. Multidisciplinary teamwork approach, more community involvement. So with all this, what we have to do? knowledge into action by creating a cancer control component, which includes prevention, early detection, treatment, and palliative care. Now, what can you do? Build partnerships with the NCCP. NCCP is nothing but National Cancer Control Program. Enhance student nurses, healthcare workers' knowledge on cancer prevention and control. So I know we are all in colleges. It doesn't mean that we will be only learning. We have to go to the community. We have to utilize being a student nurses also, the opportunity we are getting, and we have to do our best. Priorities can be given in the field visits. Develop clinical pathways in the existing system that the knowledge put into practice. Develop the nursing workforce as agents of cancer prevention. What can we recommend? Bringing the nursing standards of cancer nursing to a higher level. Sound education to develop nurses' knowledge, skills, and attitudes toward cancer prevention and control. It should be in English medium and focused on usage of internet for current information, because India has multi-linguistic approach. So English is a common language where everyone can just take it from that. Changes to nursing curriculum are recommended to expand oncology content. Specialization in oncology nursing should be considered with curriculum development. What can we recommend? We can convey this to the Ministry of Health to accept. And I have given a very good example what has happened when I was discussing with the Ministry of Health and Family Welfare, where I got the feedback also what has been done by the government. So this is not coming just like that from the government. It is we all pushing or just motivating or just triggering the government, private sectors, public sectors, everyone, so that this is coming out in action. Overcome shortage of nurses and their heavy workload. Encourage further nursing research to introduce in this important area of cancer prevention and control. As nursing teachers, where are we? Where should we have to go? What is the global trend in cancer prevention and control? What is our aim as nursing professionals? Think about this and take your responsibility as a nurse teacher to prevent and control cancer care. So what we can do, we can just explain to the people, our own professionals, why we are taking each and every area important. Tell them with facts and figures. Identify the risk factors and tell them this is the reason we are imposing on these areas. For breast cancer, please teach. Don't think that one breast cancer patient already got treated means you need not tell about this breast self-examination. You should remember that each and every individual has two breasts. If one breast is affected, the other one is having a higher risk. So continue, ask them to do breast self-examination. There will be many queries. They'll be asking when we have to do, what we have to do. Okay, when you're telling about the 7th day of your menstrual cycle, you have to see means if I am a person who has attained menopause, when do I do? These are all the questions you should have answers to explain to them. So please encourage breast self-examination, teach them. Let it be 100 times also. If they ask question, please teach them so that we are cutting or nipping the bud at the bud stage itself, so that we have a healthy society. So explain to them how to do, show them directly so that they understand. So help them with pictures, pamphlets, etc. So inform them, screening mammogram, genetic counseling. There are preventive drug therapies who are at high risk. They can just take that also, give them information. Give them the timings, when it has to be done, at what age group, what should be done, when to go to medical help. Please take into consideration. Now, we think that breast cancer is for women only. No, breast cancer is for men also. Please help them also. That's why I said equality is not there. Discrimination is there in gender also. So we think that breast cancer will not be affecting the men. I have personally treated at least minimum 7 to 10 patients who have come to me. So please encourage them also. And I have my students who will tell, when I take self-breast examination class, they will tell, ma'am, we will just go out, ma'am. I said, you're the first person to be here than my female students. The reason is no man is single. The man has the mother, the sister, the wife, the daughter. That man is going to be the best person to explain if he's really taking care of his family members. So never neglect any person when you're talking about this breast cancer. Please involve all the male people. What we wanted by doing all this health education and promotion, we don't want this type of breast cancer seen. We wanted the breast to be seen as seen in this picture. So role of the nurse in promotion of quality of life among breast cancer survivors, I'm going to talk about, because I'm dealing with patients who have already been diagnosed with breast cancer. So how I'm doing it, I wanted to just pass through for the next 5 minutes so that you will understand, even though I am in the education side, how I have been attracted towards the clinical side. It is because the bridge what made me to bring to is my research. Now, why that research I took? Every time when we study research, our teachers must have said that, see that what you can just find a solution for a problem. That is what is research for. Yes, that is really, if you just read the words alone, you will not understand this. But when you come across and when you live with your people and your family members who are affected, you will know what is the real meaning for that. I will just show you what I have done. This is again to create an awareness and disseminate what I have done, really helping many people. I'm sharing with you. As cancer care continues to evolve, nurses will play a key role in the field of oncology, whether as specialized oncology nurses providing clinical care or as a nurse researchers spearheading groundbreaking oncology research. So this is an introduction how we can help. So I'm going to just bring this journey. Here I have one of my family member who had been diagnosed with breast cancer 28 years before. She developed a complication because of that, and she has got rectified. Now, I had been part of that in the journey and found a solution for that. So in this journey, I just came across one organization where this is also fighting for certain problems which is related to cancer. So their goal is to raise awareness, educate the people, and provide outreach, especially this complication because of breast cancer. So you can see what they are doing. They are conducting certification course, which I underwent, and I am really able to handle that, because I don't know how many people we have just studied about this condition called as lymphedema. Many are not even knowing whether it is there or not. But when I was having my family members suffering with this condition, I know what are all the problems they faced physically, physiologically, psychologically, emotionally, everywhere it has got affected the whole family members. So I thought, why can't we do something? So I underwent this certification course, being in the education side also. I underwent this. This really boosted my motivation, my confidence that I can do individually, independently in the clinical area, and it really supported me. So these are the pictures where I was just involved in that particular practice. So as you see, I am the only person in Karnataka who is dealing with this. So what is that? We have heard about rehabilitation. Have you ever heard this word prehabilitation? It's nothing but what we are talking today topic, those are all coming under prehabilitation. Now a breast cancer patient has diagnosed, got treated, but they are still having a long way to get out of this. This lymphedema is a lifelong life, means the throughout the life they have to suffer. That is there. Why it is? Because the lymph nodes are being removed. Now, if you are not alerting at the early stage, then they will land up in many problems. So this prehabilitation, a word you just see in any of the condition, it really helps. So that includes screening and early diagnosis, limitation of deformities. So this is what is the prehabilitation's role in the cancer care continuum. So usually what we do once the cancer has been diagnosed, we immediately post them for surgery. But before that, this is the area we nurses have a major role. What is that? We have to teach them what are all the post-operative exercises they have to do, what is the nutrition they have to just follow, what is the psychological support they can just get from others, and independently, individually, how they can support themselves, and what are all the lifestyle modifications they have to follow. If you just take care of this area as a nurse, what will have its impact? The functional status increases, the cardiorespiratory reserve increases. Now, during the cancer treatment, they will be undergoing so many problems. This information is supporting them, and they can just overcome with what are all the after effect of these treatment. So thereby their quality of life is improved because the cardiorespiratory fitness is improved, muscular strength is improved, physical and functional status is improved, fatigue has got reduced, post-operative complications got reduced, and the length of hospital stay has drastically reduced. So this is all through the time factor. We have to just see that. So I did my study in breast cancer related lymphedema. When I was just going and doing, I did it in home care, that is in the community. Now you may be seeing that when Madam Jolly was reading, I am a medical surgical specialized nurse, cardiothoracic. Now how did I come? Because my family member who was suffering has pushed me to find a solution for this. So my PhD was totally in the community. I went each and every corner in Bangalore where all the breast cancer patients were there. I took the permission from the municipal corporation to do the study. The government supported me by giving permission, and the doctors, whoever was there, they accepted what I'm going to do, and really it helped. When I went to the patients, I found that they were not understanding or they are not aware about this condition at all, but they have come across the symptoms of this and they have suffered so much. So what I did with all this outcome, I created a pamphlet or a handout where it says how to reduce this. So this I am giving it to patients who are undergoing breast cancer. I just give that so that before they could get that complication, they can prevent and protect themselves than getting that disease themselves. So I have just clearly narrated in this. Now, as I said, the mobile is the best source. I'm sharing it as e-brochure. So patients are very comfortable. Whenever they have a doubt, they just open, they see, and they are just benefited out of that. So you can see the health condition is the breast cancer. How this interactions between the components of International Classification of Functioning, Disability, and Health in the breast cancer has helped out. So this is the schematic representation. So these all are going to help. I have just put it in a pictures queue or the model form. Now rehabilitation model for patients with breast cancer. So we identify the problems and issues physically, psychologically, and socioeconomically. Rehabilitation types are not single, it is many types: physical rehabilitation, educational programs, psychosocial or psychological rehabilitation, social reintegration. What will be the activities relevant to that has been incorporated, and what is that outcome we will be getting if the patient participate, the quality of life. So we have different roles, you all are aware already. So each role we have to play in what way. So as an educator, we are not going to talk about only oncology nurse. In oncology nursing itself, we have advances. So we have to go through that. I don't know how many of you have heard about the patient navigators. We have professional navigators who run through an individual patient who has got diagnosed throughout their life, including the family members and the caretakers, so that they can just help until they are able to have a peaceful life. Help the patients to be independent, support them. Initially, be helping them dependently, slowly wean out of that and make them independent, so that being a lifelong process, they have to just get strengthened themselves. So help them in self-care. So researcher role, as I said, even if you're post-graduation or in BSc also, you have an assignment or a project in 4th year, please select something which is relevant to the World Cancer Day. See what you can do at your college level, community level, incorporate that, find out the problems, find a solution, and educate, communicate, and get involved so that it helps the profession also. So as an administrator, identify, find out different ways how you can gather awareness programs. So these are all, you can see this, these are all cancer survivors. So they all had different myths. So when this doctor just took herself, she just saw, I am going to give a solution by just breaking these myths so that people will understand. So she brought the same patients, talk about their condition, talk about their experience on the stage so that other breast cancer patients will be knowing what is happening and how they have come out. Really, this session was being appreciated so much. And I really thank this team for giving the motivation and breaking the myths, especially the breast cancer. So you can see that the programs are going on with people. You can see that I am part of this organization where there is a support group for cancer and survivors, and activities we plan. We just encourage them. We ask them to come out so that they get self-motivated. So I get into all these programs. Every month I just conduct an awareness program free of cost so that I can just help our professionals to get aware about this condition, and what we can do, I share so that it helps, motivates people, and we all join together to face this particular condition. So you can see that here, Dr. V. Shanta, I'm very happy that I was just, this is the last photo I have taken with her. And after that, she passed away. I was so happy. She is one of my motivator who has helped me, my family member who was suffering with the cancer, because she helped us a lot. So I was able to be along with her. You can see here the hospice or palliative care. I take my students along with me. I also, my teachers also come along with me. We just work in their kitchen. We work along with the patients, and we just join hands together to help each other. Now, advances in the medical technology, what are they? It is rapid response to the new needs. You all know that COVID really have put all of us into jail. That is our home itself. So we were not able to reach. I was not able to reach the patients who were just a follow-up of my PhD samples. So they were all calling. So I thought something has to be done to just help them out. I did teleconsultation. So celebrating the role of nurses in meeting the current challenges of the cancer care delivery, you can see that telephone calls, phone consultations, and providing education and support also was happening by the nurses like this. Patients who want to visit nurses and the doctors for any procedures also were being educated on how to use the surgical mask, adopting proper hand hygiene, screening them for fever, respiratory symptoms, and travel history. Everything was being explained. This is all not only for the public, especially for the cancer patients. We conducted, there were old age homes, they were asking for help, how to manage. So we were conducting programs for the caretakers in the old age homes. So it was really helpful because of the modern technology, that is the video consultation and video webinars, which today also we are doing. So this is one example where I had taken one of my patients for follow-up through video consultation. I asked them to just explain the procedures, whatever I have taught. They did it in the video consultation. I was able to analyze what are all the mistakes. I wrote it and I just sent it to their email so that they are just seeing and identifying what can be done until they meet me. So really it helped me a lot as an individual, as a nursing profession, and I was able to be a helpful person, source for my patients. the future of oncology nursing is really bright because of the number of cases. So nurses are in a prime position to own cancer prevention discussions in their practices and communities. We are the most trusted and respected healthcare professionals. Although it seems like people should know much of the cancer prevention information already, they don't. So they also surely don't put it into practice like they should. As nurses, we can be consistent educators and encouragers. We are in every segment of the community and can reach every part of the population. So we recognize the power of knowledge. We know that every single one of us has the ability to make a difference, large or small, and that together we can make real progress in reducing the global impact of cancer. And already what we have discussed, this is the summary. So I encourage evidence-based practice. I just help out palliative care and hospice care for this, especially breast cancer patients who are really suffering. I have taken this specialization. It doesn't mean that I'm going to restrict. I am also taking care of patients who have gynecological cancer also, because lymphedema is seen in that patients also. So it is not restricted to breast cancer, even though I have done my study in breast cancer, but I'm extending my care to all the patients, whoever is referred to me because of the study I have done, and the society, my healthcare professionals are really respecting that, and they are telling blindly, you are the expert, please go ahead with the treatment, ma'am. This confidence from the other healthcare professionals, we usually comment very badly, but here I'm appreciating because they believe in what we are doing. They don't think that I'm an education, but my work is really making them to hand over their patients to me. I'm really proud of that. I thank God for giving this particular special area of practice. It really has a meaning for my life. I think I should be thankful to whoever has supported, including my patients. Thank you. I thank Dr. Dinesh sir for giving this wonderful opportunity to share with you all on this particular topic. I thank Professor Jolly ma'am to just introduce me, Sir Raghavendra Joshi sir to support me in this technically, and Dr. Venkatesh, who has been a bridge between me and Dr. Dinesh and your Sarvodaya College of Nursing, and of course our patients and health team members. I really thank everyone. If you feel any questions are there, please ask me. We call on you, whoever and wherever you are, to play your part in creating a cancer-free world. I wanted to tell this because each one has a big part to do something for our society, especially in this area. Please come, feel free to just approach me if you feel anything you wanted for your family members or your friends or anywhere. Consult or keep in touch with me. I can do the best what I can do. Thank you very much. Thank you for just listening to me for the past 1 hour.
Thank you, madam.
Yes.
It was really very motivating and inspiring. Hope all the student nurses and other teachers and staffs who have joined with the other colleges would have felt the same. And really, we also feel proud, no, being a nurse and you doing this kind of wonder to the patients and bringing change in the lives of the cancer patients, and the support services what you give really highlights the role of a nurse, which is very apt for the today's webinar topic also. And of course, all the participants who have attended would have feel more inspired and motivated. I got personally some messages from other faculty also. How you got, madam, here? It is very motivating. Like, really, thank you. Thanks a lot, ma'am.
It's my pleasure, sir. My
Yeah.
pleasure. The confidence you had that I can do a justice for
Sure,
this
sir.
particular day's webinar. And really, I'm happy to share because I did.
Yeah.
If you just ask me,
Correct.
this PhD topic, I selected in 1999. Till today, there is no solution for this particular condition.
Okay.
So that means we are able to do something, a change.
Yeah, sure. Yeah, sure.
So
That's
why
what
can't
the
we
other,
do?
yeah, that's what the others also should learn from this webinar, how
Yes.
they have to keep on working with their passion and bring changes in the lives of the
Yes.
patient rather than being an ordinary casual nurse.
Yes.
It's really motivating, madam, really motivating and highly inspiring.
Thank you, sir. Thank you for your support.
Yes. Joshi, you can continue.
Thank you, ma'am. It was an enlightening speech and an honor to have you as the speaker for today's webinar. You have highlighted on the theme of the day, which was inspired all of us. Now we'll go ahead and take some time for questions now.
Yes, sir.
Just a reminder, please be sure that you type your questions into the chat box. Yeah, the first question, which is asked by Mrs. Vijay Lakshmi, how far genetic testing helps in determination breast cancer?
Yes, sir. It is not only for breast cancer, for anything. There is a particular test. If anyone wanted to find out, they can approach me. I myself have undergone this test. It takes 1 month for the report to come. It's just a 10 ml of blood we have to take, and it gives the big history of, I don't know whether you all are aware about the marker cells, tumor marker cells. So everything is being analyzed and it has been given as a report. And there is a person who is a counselor who will explain what it is for a lay person, what this means, what this test means, what is the outcome, how it is going to have an impact for your family members or as an individual. Everything will be detailed, explained to the individual. So there are genetic tests.
Okay, thank you, ma'am. One more question by Vijay ma'am again. Is cosmetics linked to higher risk of breast cancer?
Yes. Yes.
Okay.
Cosmetics really has its impact. That's why when I just come across with patients, being a nurse is a good thing. We may not be a nutritionist, but we have studied nutrition. Okay, the same way lifestyle modifications also I impose on them. I just tell a bit of each and everything which is important for them, whatever the time I get, because what the procedure I do as a treatment protocol, I get some time along with the patients. So during that time, I don't simply just shut my mouth and do that procedure. I just take that opportunity, tell them what is that. They also communicate with me. I just impose on what are all the lifestyle changes we have to do and to overcome this.
Okay, thank you. There is one more question. What are the nursing measures to reduce lymphedema? I
showed you. So there is a risk factor. Okay. So what I do, there are doctors who refer patients to me. Today is the surgery being done. It is not that all the breast cancer patients or gynecological patients are going to have lymphedema. It depends upon the risk factors like the number of lymph nodes removed and the radiation therapy and certain chemotherapy. These are all have an impact on the side effects. Okay, they developed lymphedema. So what we do in collaboration with our team members, we just teach the patient. It is called, the technique is called as manual lymphatic drainage. We just teach the patient the next day of the surgery where they have recovered from anesthesia and all, because after that we leave means they don't come back to us. So we teach them how to do self lymphatic drainage, and we provide with a sleeve if they are at high risk. An arm sleeve, a compression garment is being recommended. They will be doing that with certain exercises which are going to help prevent lymphedema. This is the protocol we are just helping out for the patients, and that is the nurse's role here. Otherwise, other people will come and take over our role. So I lead that, and I say that any patients, please send them to me. I'll take care. So this is how I am just encouraging. So the day surgery is done, madam will just remove all whatever the lymph nodes are there. She will analyze. Yes, this has to be referred to Malar. So immediately on my phone, the patient details will be flashed. So they will approach me. I will go and help them.
Okay, ma'am. The next question is, how oncology nurses are different than other nurses?
See, there are certain characteristics for nursing role in oncology. It's not the same. Each department has its own. This one, I have undergone everything in 25 years. Okay. In oncology, as you said, the stigma, we ourselves should be emotionally stable to see the patients, handle the patients, the family members. They will be in different phases of lifespan. They'll be depressed, they will be aloof, they will be lost, they will not cooperate. So many things will be there. We as nurses, we have to develop ourselves, gain knowledge in overcoming all these problems as a professional ourselves, and how to handle the patients and the family members, and extend this care not only in the hospital but to the community. We have extended and expanded roles. We have to utilize this. We in the hospital, we have to hand over to the community nurse. Then there is a bridge where the gap is being closed.
Okay, there is one more question, ma'am, by Priscilla. Once a cancer cell emerges, how long does it take to become clinically evident?
It depends upon. That's why when we are doing self-breast examination also, it's not going to prevent that we are not going to get a breast cancer. We are going to identify it. It depends upon the location of the breast cancer cells. If it is in the outer surface, then it is going to be easily identified when you are doing self-breast examination. When it is in deep-seated, then you need some supportive diagnostic test, which is going to help us. So each and everything, even though if it is deep-seated, you will have changes where you will have pain, because the lymph nodes are the main markers where it will tell that there is a swelling. That means some infection is there. So that's why we encourage self-breast examination, so that you analyze, you feel your breast. So every month you do this, you know what is the difference between last month self-breast examination and this month self-breast examination. Automatically you get alert and you immediately approach the doctors.
Okay, ma'am. There is a last question by Ms. Vimlesh. Which stem cells are used mostly in the treatment of cancer?
It's a vast area. You need a separate topic. Stem cells, it is a separate topic. I think separate session has to be arranged by experts. I think sir Dinesh sir will help.
Yes, sure, ma'am.
Because now students and public or whoever it is, they are interested in these areas.
Yeah.
Then we should. It's the motivation for us to arrange the next topic, I think.
Yeah, sure, we will arrange. Sure.
Any other questions? I am here and glad to just clarify. Hope the answers are okay for everyone, acceptable.
Yeah.
Any other questions?
Any other questions?
Okay, I think we have covered all of our questions. Ma'am, would you like to wrap up?
Yes, sir. Thank you very much for all of you for patiently sitting. I have exceeded at least 7 to 8 minutes from my session, I think. But I was happy that I could share in this platform what I have
very
done.
Interesting, madam. Of course, even though it's not the sort of extension, it was very interesting. And some would have felt that the concept all had been covered. It was really very interesting and very nice to have you for this webinar. And it's really, I think most of the participants would have gained a sort of inspiring knowledge after your webinar. Sure about it.
Usually we think that being a principal, I think that we should be in the clean teaching side only. But one positive thing I have just followed is wherever I go, I wanted my hospital. If hospital is not there, I won't stay there.
Correct.
Because my patient is my first book.
Correct.
This was being incorporated when I joined nursing by my teachers. And today I can put it in practice, and really that is helping me to do all this, because I don't have any fear or threat to handle my patient, because that's part and parcel of my daily living.
Yes. Nice, man.
So if everyone does this, I think it will be a really good environment, and our nursing profession will be really appreciated. And I showed you that Facebook message. I was so much impressed when I just read that not even a single person that doctor has left. It was so impressive. So we wanted to bring our profession to a height, means we have to present ourselves in a proper way.
Correct. It all starts from us.
Yes.
And your talk today will motivate many of them to start the way how.
Hope so, sir.
You have
Thank
told.
you.
Yeah, it's very inspiring. Sure, it's going to bring a sort of change in the minds of the young people. Now, most of the student nurses who attended,
I know,
there will be a sort of change in their mind towards oncology, and their perspective would have already changed would have motivated them to learn more and to become a good oncology nurse, and how to balance themselves in taking care of the patient and bringing quality service and bringing change in the life of themselves and also in the life of the patient. A wonderful session, ma'am. Really, we are very thankful to have you for our webinar. Sure, we will be in touch with you, and the feedback form we will share with you, and also the students and the other participants feedback on the various other topics also will be considered, and sure we will approach you again for next another topic. Thank you.
Sir.
Thanks a lot. Thanks a lot.
So
thank
much.
you for the other organizing committee and also to the participants. Thank you very much to everyone. Thank you, ma'am.
Thank you, sir. Good day, sir.
Yeah, we will end this session.
Hi, thank you everyone. We appreciate